whenever you're ready.
Today will be a normal day for the majority of you. You'll finish this class and you'll go to another, or you'll go study at the library. You'll stay up late tonight doing homework, or you'll stay up late watching Netflix. At the end of these 24 hours in College Station, you will have gone about your normal college student routine. While somewhere in the world, 134 newborn babies will have died from a disease that you've been vaccinated for without a second thought: tetanus. Maternal and neonatal tetanus, or MNT, is still an epidemic in many poor areas of the world, and the Eliminate Project works to alleviate this issue and needs and deserves your help. Today, I'm going to inform you about the realities of maternal and neonatal tetanus, tell you how the Eliminate Project is working to lessen those effects, give you a picture of a world without countries being held back by tetanus, and let you know how you can get involved and make a difference yourself. I'm going to begin with the causes and effects of tetanus. Countries with a lower quality healthcare system cannot provide their citizens with the immunizations that we take for granted here in America, such as the one for tetanus. Many Americans don't know the realities of how tetanus works. They think it's just stepping on a rusty nail and getting a little sick, when in reality this disease is so much more than that. A 2010 article by Carol Stern says that MNT is 100% fatal if left untreated, but is also 100% preventable with the right resources. According to the World Health Organization, newborns infected with tetanus do become infected either because the instruments used to cut the umbilical cord or the hands of the person delivering the baby are contaminated. Also, the effects of a newborn being infected by tetanus are devastating almost immediately, as they stop sucking within between 3 to 28 days after birth, rendering them unable to eat. They also suffer from severe and painful muscle contractions and spasms as their bodies go stiff and they become very sensitive to light and to touch. According to the Kiwanis International website, the total number of newborns dying every year has decreased actually from about 60,000 to about 49,000 since the beginning of the project in 2010. This is significant progress and a reason to celebrate, but we cannot stop yet because it's just not enough. Luckily, thanks to the Eliminate Project, that total is continually on the decline. In 2010, two nonprofit organizations, Kiwanis International and UNICEF, joined forces for the goal of eliminating maternal and neonatal tetanus from the entire world by the year 2015. According to an article from August by Josh Arnett, just 3 doses of a tetanus vaccine at $1.80 apiece can save a mother and all of her future babies from tetanus. That's what brings so much hope to this cause, because there is a cure and it's very in our reach for many parts of the world. The only problem is getting it to those parts of the world where it's not so accessible, and that is the goal of the Eliminate Project. Eliminate estimates that to completely get rid of tetanus in the world, 100 million mothers and their babies will have to be vaccinated, which ends up, as you might imagine, not being easy or cheap. When they add up the cost of the vaccines, syringes, safe storage methods, transportation, and the payment of skilled workers, the Eliminate Project estimated that their goal would take $110 million. According to the Elimination Progress Dashboard on the Eliminate website, $71 million has been raised since the beginning of the project 4 years ago, which has, of course, led to significant progress. At the start of the project in 2010, there were still 39 countries across the world that were still afflicted with tetanus, who didn't have a preventative method for it or access to it. 4 years into the project, the $71 million that has been raised has resulted in the total eradication of MNT from 15 of those countries, the most recent being Madagascar just earlier this year. This, again, is a very impressive accomplishment, but we can't rest yet because there are still 24 countries in the world that are suffering from maternal and neonatal tetanus. This is not a cause for discouragement, but for increased diligence, because this goal is very much in our reach. The Eliminate Project aims to reach the most impoverished mothers and children across the world, the ones who don't have the money or resources to protect themselves from this disease. Reaching this goal of $110 million is a very real possibility. According to the article by Josh Arnett from August, Kiwanis International and UNICEF previously partnered to eliminate iodine deficiency disorder and succeeded in raising $105 million for that cause. According to a progress update from just a week and a half ago, there's been a 15% drop in infant deaths due to tetanus from the beginning of the project in 2010 to 2013. This shows that the project has been making progress from the very beginning and is therefore very deserving of your support. Imagine Imagine a world where mothers don't have to worry about their babies making it through their first month of life, or first week, or first night of life, even in third world countries. When the populations of the affected countries are added up, it totals over 2 billion people, over 7 times the population of the United States. Imagine a world where MNT isn't just eradicated from 38% of the afflicted countries in 2010, but 100%. Imagine a world where mothers and babies dying of tetanus is a thing of the past and you played a part in it. Helping this cause will not only save thousands of lives around the world, but it'll give you the satisfaction of knowing that your time and money has gone to a worthy cause. Luckily, giving of yourself to this project is easy and very satisfying. There is a college branch of Circle K International, of Kiwanis International called Circle K. We have a club right here at Texas A&M, so you can get involved where you live. You can make a donation online, or you can sign up for their weekly newsletter. Today I've covered the tragedy that is MNT, told you how the Illuminate Project works to alleviate it, told you what their efforts can make our world look like in about a year and how you can further their efforts. Progress has been made, but progress can only continue to be made if the Illuminate Project support system progresses itself. Thank you.
Okay, any questions for Nikki? Mark.
What made you choose this?
Okay, the Kiwanis International, one of the nonprofits that partnered to make this. They, like I said, have their college branch, Circle K. They also have a high school branch called Key Club. And I was like a member and an officer in my Key Club at my high school, all 4 years of high school. And so I learned a lot about this issue all the way from being a freshman in high school. And I just began to care a lot about it and saw the actual effects of it because I started high school in 2010 when this project started and when Kiwanis International started really broadcasting this. So I've gotten to see the effects of what like the various clubs that I've been involved in have actually done for the cause, and I love to see the actual progress that they've made.
When do you all think that you're going to raise enough money to like completely cure all of it and stuff?
Like I said, the goal is the eventual goal was 2015, and as you know, 2015 is very close. There is actually, I believe, in 2 weeks or so, there's like a World Report Day, International World Report Day for the Illuminate Project, and they are going to, at that point, kind of determine where they are and see if it's really going to happen in or during, like by or during 2015. So I'm confident that it's possible, if not by 2015, by very, very soon after. So I can update you guys if I find out how that goes in a couple of weeks when they figure out where they're standing.
Are you part of the collegiate